This podcast is intended for healthcare professionals, including dentists, for educational purposes only. It should not be considered medical advice, a product endorsement, or promotional material. Welcome to Decoding Dentine Discussions, the podcast that takes an in-depth look at the latest advancements and best practices in dentine hypersensitivity. I'm your host, Dr. Shaista Siddiqui, and in today's episode, we'll be tackling the Dentine Hypersensitivity Challenge, Myths and Realities. Today, we're very lucky to have Professor Hesham Marei, Professor and Consultant in Oral and Maxillofacial Surgery, as well as the Dean of the College of Dentistry at Gulf Medical University in the United Arab Emirates. We'll be debunking some myths and discussing how the panel has implemented changes throughout the series, as well as the challenges of educating both students and patients. So before we start talking about our today's topic, Professor Hesham, I'd like you to just tell us a little bit more about yourself, please.
About myself?
Yes.
So this is Hesham Marei. I'm a professor and consultant of oral maxillofacial surgery, and currently serving as a Dean of College of Dentistry at Gulf Medical University. I also have another qualifications, as I have also a master and a PhD in medical education. So I carry two hats, one as a MaxFax consultant, providing a full scope of oral maxillofacial surgery to patients, and the other hat as medical educator, in which I get involved in curriculum design and developments, faculty developments, student assessments, accreditation stuff, which actually part of what I'm doing as a dean for the College of Dentistry at Gulf Medical University.
So what do you like doing for fun is my question now.
I usually go to the gym during the weekends just to keep myself in a good fit.
This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne is clinically proven for long-lasting protection against dentine hypersensitivity with twice daily use. Just as a reminder to everybody, in June 2024, Halion and CAP hosted an international advisory board which was focused on the diagnosis and management of dentine hypersensitivity across the Middle East and Africa. In this series, we've explored a lot of topics such as the etiology, the management, the science behind dentine hypersensitivity, the interdisciplinary approach to dealing with this, and the correct treatment modalities at various stages. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website. Today, what we will start off with, I'd like Professor Hesham to talk us through the advisory board, what his experience was when we held that advisory board.
It was really a very good meeting during the advisory board, and I acknowledge that there were a lot of expertise from different specialties and from different countries at the Middle East. Actually, having expertise, professor and consultants and clinicians working together from different countries that not only make a synergy in terms of getting the best outcome, but also allow us to have what we call it an opinion that is valid on experts delivering the best content. From that perspective. So the validity of the opinion, of the expert opinion that would be presented out of having that advisory report is actually, I would say, a highly valid and highly reliable.
Absolutely.
Yeah, because it's coming from a group of different experiences.
Different experiences, different specialities, different opinions as well. And to think that we managed to get a consensus between all these 12 different people, I think that was incredible.
Yeah, that is correct. If you look into the hierarchy of scientific research when it comes to evidence-based practice, you'll find that expert opinions would lie on the bottom of the pyramid. Having said that, still getting 12 experts, that would give more powers to the opinions coming out from that committee.
Yeah, gives lends it a little bit more gravitas. So one of the things that I felt was highlighted to me during the ad board was education, okay, both for the patients as well as the clinician, and clinician at an undergraduate level as well. You know, we felt that how they were taught, what was taught was lacking. So one of my questions to you, and I think this is very important, the answer from you from the position that you hold at Gulf Medical University, which changes have you implemented since the advisory board?
Looking to the importance of that specific condition and topic, I actually called for actions, all faculty members in the restorative department and prosthetic departments, in order to integrate that important topics within the curriculum. So we have done something like a curriculum mapping in order to identify gaps related to that topic. Then the topic is embedded within the different courses and being shared between faculty members vertically within the curriculum. So students at different levels in level or year 2 and year 3 and year 4 being introduced to that topic in theory and in simulation and also in clinical practice.
Amazing. How easy has this been, doing the curriculum mapping, organizing student assessment, giving clarity to students? How easy has that been?
It is a responsibility of every faculty member to ensure that he is up to date when it comes to an important topic like this. And also it is important for every faculty member to be aware what colleagues are giving within the same topic, because sometimes one topic can be tackled from an oral surgery perspective, and the same topic would be tackled from an oral medicine or from a restorative point of view. So for me, being aware what my colleagues in other departments has delivered, that is important. So getting the faculty members to sit together to discuss these points that facilitated the implementations. Plus, we added a few faculty development sessions in order to bring everyone on board, get everyone have the same background about the topic. So all the opinions of the faculty members would be converging toward one thing, not confusing the students.
Perfect. And from a patient perspective, how are you able to quantify or correlate how they're being educated? Are you able to do that, or is it early days yet? You know, if there's been any impact on their dentine hypersensitivity symptoms, or are they coming back? Are they taking information on board?
Drawing a cause and effect relationship between getting a topic integrated within a curriculum and its effect on the patient. That is, again, a bit difficult because there are a lot of confounding factors that could contaminate that relations. One of them is patients are following the instructions, for example. So the students could have learned the topic, giving the instructions to the patients, but the patients didn't get improved because they are not following what being delivered. And as you know, that is common in the practice of oral hygiene, different oral hygiene measurements. So, however, we are putting all the efforts and having that advisory report with that consensus actually help of getting consistent application of best practices through integration of international guideline and best practice into that algorithm that been actually delivered out of our advisory board meeting that ensures that all patients receive care that is consistent.
So actually, I want you to expand on the algorithm. What are your thoughts on the algorithm that we came up with, and how is that being implemented?
Actually, that came as a result of what we call it a content analysis of what been delivered during the different sessions of the advisory report, and incorporating also the best practice and the evidence-based practice and different guidelines of different associations being published before. Having everything together that is contextualized to Middle East and to what the patients in Middle East and in UAE are having in terms of diet habits and in terms of brushing habits. That again was important. So that algorithm is coming in the form of an articles to be published, and that will allow a consistent application of best practices. That also would allow for the young generations and general dentists in the community to enhance patients management and educations, because when the patient is aware of his condition and aware of how it would be treated, what would be the sequela of leaving it, that is again important. And the third point, which I would consider it really crucial, is streamline workflow for dental professionals. That is important, especially when we want to do a study on large scale. Sometimes it's very difficult to come out with a conclusion out of any research projects due to variability in implementations across dental professionals. Having an algorithm that is coming on our publications that facilitate actually that streamline of the workflow.
It streamlines, and I think, our undergraduates of today, they're young, their brains work faster, and I feel, I think back to my undergraduate days, we were told how to do A, B, C, D, and it becomes, part of your nature to do this. I do the oral cancer screening, we get it done. It's my every time examination. So for me, I feel the algorithm, the more it's implemented at that stage, it becomes second nature to these guys, and it's something that then becomes a preventative measure. It's dentine hypersensitivity is diagnosed earlier, it's monitored that much more earlier, and it's treated earlier, and hopefully prevents these patients developing the worst case scenarios for their teeth.
I completely agree with you.
So I'm going to ask you a few myths related to dentine hypersensitivity or fun facts, okay? So myth one, tell me true or false, what you would say to patients or what the reality is. Only people with poor oral hygiene experience dentine hypersensitivity.
No, even that is a myth. So the reality is even individual with excellent oral hygiene can develop dentine hypersensitivity due to factors like aggressive brushing, enamel erosion, or gum recessions.
Agreed. Avoiding brushing sensitive teeth is the best way to prevent pain.
In fact, skipping brushing can lead to plaque buildup, worsening the sensitivity. So the best thing here is to use a soft bristle brush and gentle techniques that would be recommended.
Yeah, in one of the previous podcasts, Professor Arwa, she'd mentioned a case where a patient of hers, he was feeling so much pain, so much sensitivity that he stopped brushing his teeth, and things had got so bad, his engagement broke off. So that is a sequelae that people have to consider as well. Your next myth is dentine hypersensitivity is a sign of tooth decay.
Actually, while dentine hypersensitivity and tooth decay can cause discomfort and might be overlap and the signs and the symptoms, they are two different conditions. Dentine hypersensitivity is typically caused by exposed dentine, not a decayed dentine. Yeah.
And I have another one for you. Sensitivity toothpastes provide instant relief.
I believe that desensitizing toothpaste can be effective, but it usually requires consistent use over a period of weeks to start seeing significant effects.
Agreed. And I think you have to be consistent in using it as well.
Correct.
If you stop using it, you'll get back your symptoms. I have one other question for you. Especially in the Middle East, you find people using the miswak a lot, right?
Yeah.
And that too can cause problems because they've eaten, they take it out and they start using it, and I don't know how it's stored either. How would you, a patient who is using this and you want them to reconsider how they're using it, how would you approach this sensitively?
I would give patient educations toward oral hygiene measures that are packed with good evidence in the medical literature. I would tackle it from that perspective.
Yeah, okay, because I think it can be a little bit of a sensitive issue as well.
That is but when I explain to the patients and provide some evidence, some guidelines, that the patients would be, I think, will listen to that.
Perfect. So going back to the ad board, what do you think were the key or positive benefits or highlights from there?
First of all, definitely enhanced collaboration and knowledge sharing. Having interdisciplinary insights. The advisory board brought together experts, as we said, from various fields, allowing for a richer exchange of ideas and strategy in managing dentine hypersensitivity. Also sharing international guidelines and case studies provided a broader perspective on effective management of dentine hypersensitivity across different regions. Having updated clinical guidelines and protocols that is customized and contextualized to the Middle East. That also allowed for what we call it international research and collaborations and development of opportunities that would lead to further research and fostering opportunity for future study in the management of dentine hypersensitivity in the MENA region.
So is there anything you would say we could have done differently? Is there anything that's given you food from thought from the advisory board that you want to maybe explore further through your position at the Gulf Medical University?
It actually opened my eye in that advisory board and that meetings toward the topic that is could be falling at the middle of different specialities. So sometimes topics like this get lost within a curriculum of undergraduate or even postgraduate studies. So that is, again, was eye-opening for me as an educator, as a dean for the school, that that topic would be, with all that research and articles that are presented in the literature and guidelines, that again emphasize the importance of getting this to undergraduate students.
So just going back to your undergraduate students, the course at Gulf Medical University, I'm assuming, is 5 years long for dentistry?
That is a BDS, Bachelor of Dental Science. Bachelor of Dental Surgery. This is 5 years BDS.
So having spoken with your peers and colleagues and, doing the curriculum mapping and stuff, how do you see dentine hypersensitivity being taught? At what stages would you introduce it? How would you?
It would be introduced vertically in the curriculums. So some basics would be taken at the second year during different courses, like different operative courses or restorative courses, and then reintroduced again once the students start to see patients on third year and fourth years from a clinical perspective. And also introduced within courses related to patient educations and communications, how to communicate this information. So it is actually introduced vertically at different, so it's get revisited at different levels in the theory, in the simulation, and also in the clinical practice.
Okay, perfect. I have this question for you. if we wanted to explore this topic further, understand the algorithm, understand, the questionnaires and any other materials, what's the best approach for us to look up this material? What would you advise we do?
The different databases that host the journals in science, PubMed, Google Scholar, and there are a lot of guidelines that are coming from Canadian dental associations, British dental associations, American dental associations, and there's guidelines also coming from the FDI, European Federations of Periodontology. These are all guidelines that are published either on the website of these associations or as in a context of articles that is published on different databases.
And, it's always good to read up. One thing that I really liked about your approach is, as you said, there's expert opinions, but there's also evidence-based approach to doing things. And I would really recommend everyone look up these topics. And we've also got access to materials on our website, so you can go to CAP or the Halion website and you'll be able to find information about the advisory board that was conducted. There's webinars available as well as this whole series of podcasts for you to listen to. And then as always, if you have any more questions, we've got our expert panels. Reach out to us and we'll get answers
of course.
For you. I had another question for you. What is the... I'm going to stop here because I've just...
No, actually, we finished the question.
I know, I was thinking, I had one more question in my head and then it's gone out of my head. But
how did you find it so far?
Good, thank you. No, you were really good, very natural, very good at speaking. Very nice. And like I say, your expertise is coming from the educator background, and that is what is really important, right? About
academician.
Is there anything else we can ask Professor Hesham?
I wasn't in the beginning, that's why I can't. But I rely on you.
I think something about the future.
Future.
Okay. Yeah.
Let Dr. Shaista ask about this.
Yeah.
About future.
Yeah, I'm going to propose a question.
He's going to tell me the question. So tell me.
Might something about the future. Do you think that revisiting about what could be done in the future in order to enhance, other than the meetings that have been done and the advisory reports, what could be done in futures in order to reflect and advance in relations to management of dentine hypersensitivity. And I'm going to tackle this questions by answering through area of community services, community outreach campaigns, and that is would be my answer. Okay. Do you think the question is relevant?
No, I think I was thinking about asking, this is one thing, I think you'd be familiar in the UK, you have your community program, right, where you go out, where people come to these pilot clinics and do things. Okay, let's start. So Professor Hesham, another question for you. What do you think is the future for dentine hypersensitivity? How can we further enhance our understanding, our outreach to patients and our clinicians as well?
I think here I would emphasis on community, and there are a lot of community and patient awareness campaign. That is the key. So dentists who are working as a first line of approach in the community should be having some sort of continuous professional developments related to that topic or that important problem. And also the patients themselves could be approached directly through campaigns that could be in Busy Mall or could be in arranged with DHA or MOH or Abu Dhabi Health Authority.
Perfect. Thank you. So I hope we've all learnt a lot from this. So just as a recap, in this episode, we've discussed the significant strides made in addressing dentine hypersensitivity following the recent advisory board led by regional dental experts. Key changes, including integrating evidence-based practices into dental education and clinical workflows. At Gulf Medical University, dentine hypersensitivity has been embedded into the curriculum through detailed guidelines, faculty workshops, and updated assessments, ensuring graduates are well prepared for real-world diagnosis and management. These updates, coupled with interdisciplinary collaboration, aim to bridge gaps in understanding and treating dentine hypersensitivity, a condition impacting patients' quality of life globally. On the clinical front, the new algorithm for screening, diagnosis, management, and prevention is set to transform patient care. It emphasizes consistent best practices, enhanced patient education, and efficient workflows for dental professionals. Common myths about dentine hypersensitivity, such as its link to poor hygiene or decay, have been debunked, whilst the importance of proper brushing techniques and gradual relief through sensitivity toothpaste is highlighted. These updates foster better patient engagement and adherence to treatment, promoting long-term oral health. Reflecting on the advisory board, its key benefits include enhanced interdisciplinary collaboration, updated clinical protocols, and identifying research opportunities tailored to the Middle East and Africa region. The materials developed, including the algorithm and DHEQ, will soon be available in professional journals and databases, providing clinicians with accessible tools to improve dentine hypersensitivity management. The episode underscores the importance of evidence-based education and patient-centric approaches in tackling this widespread dental condition. All really that's left for me to do is to thank Professor Hesham. I think he's been monumental in really taking this ad board to heart and implementing it at his university. I think that is just a fabulous result for the ad board. So, and thank you for coming here and spending time with us and discussing this topic with us.
My pleasure. I really enjoyed the sessions today. Thank you very much.
Thank you. This episode is brought to you by Halion, the producer of Sensodyne. Sensodyne is clinically proven for long-lasting protection against dentine hypersensitivity with twice daily use. If you would like to get CPD points after listening to the series, you need to be registered on the Halion Health Partner website and open the podcast page on this website.